Good evening, and thank you for attending our Ahead of Cancer lecture series, sponsored by the Allegheny Health Network Cancer Institute. My name is Margie Leslie, and I'm a director of the Cancer Institute. There are a few housekeeping items we would like to review before we start. During the presentation, all participants can type questions into the chat or Q&A portion of the Zoom. We will be addressing those questions at the end of the lecture if time allows. Participants are not able to speak during the conference, but again, we encourage your feedback via the chat option. Tonight, we're excited to welcome Dr. Sarah Miller and Laurin Scanlon, who will be speaking about holistic care, managing side effects and symptoms. Laurin Scanlon is a program manager at Allegheny Health Network, overseeing both the Integrative Oncology program within the Cancer Institute and volunteer resources for the Cancer Institute and outpatient facilities. She has a bachelor's degree in advertising and public relations and a post-baccalaureate degree in secondary education focusing on mass communications. Laurin has dedicated her career to nonprofit healthcare organizations. Since joining AHN in 2018, she has managed over 120 volunteers who have contributed over 27,500 hours of service. Laurin has spearheaded the creation of multiple programs focused on holistic care, raising over $400,000 to ensure these programs remain free to AHN as well as non-AHN Cancer Institute patients. Her dedication to patient well-being and community service has been recognized through numerous awards and publications, highlighting her impactful contribution to both Allegheny Health Network and the Western Pennsylvania region. Dr. Sarah Miller is a medical oncologist and the director of the Integrative Oncology program at Allegheny Health Network. She is a native of Pittsburgh, where she grew up in Beaver Falls, and Dr. Miller attended medical school at Philadelphia College of Osteopathic Medicine and returned to the Pittsburgh area to continue her postgraduate training to complete her internal medicine internship and residency at AHN. Following this, she enrolled in the Hematology Oncology Fellowship program within the Allegheny Health Network and has been practicing within the network for 13 years with office locations in Natrona Heights, which is at Allegheny Valley Hospital, and Wexford Health and Wellness Pavilion in Wexford Hospital. She leads the Integrative Oncology program, the goal of which is to help patients feel comfortable, connected, and supported throughout their cancer journey. Currently, Dr. Miller has completed an Integrative Medicine Fellowship through the University of Southern California Academy of Integrative and Holistic Medicine. Welcome, Laurin and Dr. Miller, and I will turn it over to you.
Hi, Margie. Thank you so much, everyone, for joining and allowing us to present at tonight's meeting. We can't wait to share what we do with you, and we'll get started. So again, my name is Laurin Scanlon. I'm the Volunteer Resource Program Manager for Cancer Institutes and Outpatient Facilities, and I'm also the Program Manager for Integrative Oncology. So for those of you that are not very familiar with Allegheny Health Network, we are based out of Pittsburgh, Pennsylvania, offering services to Western Pennsylvania, some portions of New York, Ohio, and West Virginia. Altogether, we have about 2,400, if not more, physicians in every clinic specialty. You can see kind of the breakdown here of where we're at and what we represent for our community. This next slide, we talk a little bit about our volunteers and the force that they really are. This last year alone, we had 122 volunteers in 2023, donating to AHN over 7,529 hours of service to the Cancer Center alone. We were able to pull a number from the independent sector. They published the value of a volunteer, which changes every year, just like inflation. And with that, we were able to culminate in total that we've saved the Cancer Center last year $239,000. Each year, our numbers and our hours of service continue to increase, and we use our volunteers in a variety of ways. It's really great because we have local patients that turn into survivors, specifically with the Cancer Center, and then come back as volunteers. So I would say about 75%, if not more, of our volunteers are either patients themselves, they've been caregivers, they've had a close friend that they've assisted go through a cancer journey. And I think that's what makes our volunteers so special. We have a couple different roles when we use our volunteers. We have the traditional hospital wayfinder role. a patient and family rounder where they take snacks like you see Debbie in that picture rounding with our cart. We have pet therapy volunteers, so they are four-legged volunteers that come with their two-legged owners and just bring smiles to everyone and offer relaxation, taking a deep breath, and a reminder just to enjoy everything going on in the here and now. At some of our locations, we offer music therapy, also encouraging a positive way to relax, take patients' mind off of maybe the wait or the appointment they're going to, and really kind of focus on themselves a little bit. We offer art therapy. And then unique to us, we have a wig fitter program. We have opportunities for volunteers to become class instructors. We also have our tried and true sewers, knitters, crocheters, and loomers, making those everyday items for our patients, such as warm hats, blankets, shawls, different things like that. Our goal in wanting to use the volunteers in the Cancer Center is really to help us do what we do best, treat the entire person and not just their disease. What I love about integrative oncology and using the volunteers as some of the resource force behind it as well, is that we can really build a team to enhance everyone's well-being. In addition to our clinic, all of our integrative oncology services really focus on different ways of caring for the whole person on a mental, physical, social, and spiritual level. What we also like to do is go a step further than just traditional integrative care by offering it to our oncology patients, really to kind of bolster what their doctors and physicians are already giving to them and prescribing. So we'll talk a little bit more about what we do to enhance their everyday life and how we make their journey a little easier through integrative oncology. One of the things we needed to do in order to find out what integrative oncology was going to be for AHN and how we were going to define it within the Cancer Center is really to understand what our patients are going through and the whole person. To do this, we took a look at different needs that patients had and found ways to give them a positive alternative to seek a resolution. Some of the things that our patients had expressed were mental health, physical health, their economic situation. Finances was a big topic, quality of life, safety, and the key and center of it, you'll see here on that one slide on the left-hand side, is the ease of access. Patients didn't want to feel sick after getting a treatment or just feeling burnt out and have to drive somewhere far away. So what we've done is we've really taken our AHN programs and made them a spoke model rather than a hub. Being a spoke model allows us to be where our patients are, close, convenient, and offering different ways to connect, such as virtual. So if they can't come in person, even though we're in their network, they can still receive top-notch services from us. Once we had all that information, we were then able to translate it, which you'll see at the slide on the right-hand side here. We talked to our professional leaders, we created a sense of community, made everyone feel a part of what we were creating here on our end. Our goal was to empower patients, definitely offer things at no cost to them, seek sponsorships so those costs are offset, so everything we would provide essentially would be free, and make sure that we had a flexible schedule, offering different days and times that would, be better for our patients. One of the early programs that we created was the WIG program. This one actually started in 2020 as lots of different nonprofits were shutting their doors due to COVID. We were actually up and running with our WIG program virtually. And for a while, we were the only virtual WIG provider in Western and Central Pennsylvania. We were bridging the gap from treatment into daily life by empowering our patients and giving them confidence. Each week, our volunteers create and conduct private appointments unique to the patient and their needs. We help a patient select a wig, a head covering, a wig stand, and we actually give them a bag of amenities that help them care for that wig and allow it to live its best longevity. All of our patients and our non-AHN patients get one free wig. We offer this service to anyone that is currently diagnosed with cancer, regardless of who their physician is, what insurance they have, and where they're treated at. And this is so important and true for all of our programs. So you'll notice a common theme is we care for our community members, whether they're AHN, non-AHN, whether they live in Western Pennsylvania or across the country. We've really made a lot of adaptations to meet everyone's needs and to really take care of our community as a whole. And I'm so excited about that because that's what Highmark, our partner, is very involved with, is caring for our community. And so are we here on the AHN front. Unique to our WIG program too. WIGs were typically given to, females, women. We really tried hard this last year to make sure that all of our salons, because we have a total of 8 salons we'll talk about in a minute, but that all of them were inclusive of all genders, ethnicities, colors, styles, and lengths. So in doing this, we're reaching a broader audience. We're helping as many people as we can. And again, that theme of taking care of our community at no cost. As mentioned before, all of our programs are in person and virtual, and we made it a one-stop shop phone number. So as we talk about all these programs, another common theme you'll find is one phone number to be the solution. When patients call that number listed below, 412-330-4045, we ask them to make sure that they have an appointment in advance because we do not accept walk-ins to any of our programs. We want that time to really listen to our patients' needs, hear what their side effects, symptoms, difficulties they may be dealing with or anticipate dealing with will be, and then mold our programs around them like a warm hug and a comfort in a time of need. When we look at where we're at geographically for our WIG program, we have our flagship down at Allegheny General Hospital, but we're also all over the map. We're in Allegheny Valley, Butler, Erie, Forbes, Jefferson, Wexford, and then finally that Zoom link. We've often had patients schedule an in-person session and then say, you know what, I'm not feeling too good. And that's really our golden chance to pivot and give them that option. So they're not missing an appointment. They're not getting a wig and having to go without much longer. And once they select a wig from our salon, we actually get it in the mail to them that day and have the option to ship it so it arrives in next to no time. We included a patient testimonial on here. I'm going to read it out loud here from Mary. It says, "I cannot thank you enough. You saved me. Perfect color, perfect style, unbelievable. It gives me so much confidence. I wore it home and it felt right and good. It looks like it was made for me." And this, every time I read it, I love to read it because it gives me chills. And this is an experience that we do weekly with many patients across the network, giving that warm hug again, like I mentioned earlier, and a boost of confidence that we gotcha. And when you're ready, we're here for you. In the photo here, you'll see some of our wig salon wig fitters from across the network. This was at a recent open house we had at Forbes. And one of the ladies standing in the middle actually home makes hats with her sewing group. They knit, crochet, and sew all different kinds of hats for men, women, again, inclusive of all genders. And her team actually supplies for our network. So you can find one of Judy, and she calls them her knit bits, the sewers, that can be throughout the network. So again, we're very grateful to her sewers, her knitters, and crocheters. Our next program was actually the first program we started. Back in 2018, it was conceptualized. In 2019, we had our pilot. It's called Care and Cosmetics. Now, I like to start off with the wig program anytime I talk about this stuff, to be quite honest, because the first thing everyone thinks about is, I'm going to lose my hair, right? The second thing they think about is, no one told me I may or may not lose my eyebrows and eyelashes. And that's where we kind of like to come in if they are experiencing or anticipate experiencing thinning of their eyebrows, loss of eyelashes. We really want to be there to help. So our program goes a step further. We not only talk about cosmetics like it says in the title, but just really self-care, how to look and feel your best, how to put on that face when you don't feel like you on certain days and step into your daily life. Again, the whole goal is daily life. What we do is we teach how to minimize the appearance of short and long-term side effects from cancer treatments with the use of makeup. Now, I don't teach the class. We have some really great, highly skilled and trained professionals that do. So our volunteers leave this class, whether they're doing a Zoom from home or they're in class, in person with us on site, feeling and glowing. They're so excited. They're so empowered. And you can see a photo here that we took from our pilot actually back in 2019 of a woman applying makeup, and look at what a difference it's making in her. The same registration we ask for is the 412-330-4045. Call in advance. We'll get anyone set up for a class open to AHN and non-AHN patients. And you can see another photo here we have again from our pilot class way back then, just patients enjoying it. And this photo, it might be a little hard to tell because it's pixelated, but our patient here actually has one false eyelash on and one eye without a false eyelash on. So again, just brightening up her face, helping her feel beautiful, and just letting her know that she is valued and seen and empowered. We have a testimonial here that says, "I learned a lot of new tips even at my old age. I really do thank you for your kindness and good tips and all of the work you do. We really need an advocate like you." And that was from Lori C. Now, in our class too, like I said, we talk about makeup, but also those wigs that we just gave to everybody, we teach them how to wear, style, accessorize based on the season. So our program's constantly changing with new tips and tricks we show folks. Depending on your instructor, they have their own different style of hats that they'll incorporate, and we really make it a fun, unique bonding experience. In addition, we also make sure we have a staff member present, clinical or myself, that can help echo any questions patients have, so they're not having to wait till the next business day to reach out to their care team. If it's something we can answer right then and there, we do, to put their mind at ease. From that class, created this other next step of, again, empowering our patients, caring for your skin and nails. So caring for your skin and nails really does talk about caring for your skin and nails. Any side effect, symptom that you can imagine that a patient may be going through, we actually have, again, those volunteers that are trained, certified professionals in their field, also involved with oncology training, have come on board to give us tips, tricks, and advice that our patients then echo to their physicians. Our program is open to AHN and non-AHN cancer patients. They can call the number 412-330-4045. We offer a variety of in-person classes throughout the network and virtually through Zoom. One of our patients, and I believe actually one of our instructors, is on the call tonight. So this may sound familiar to her, but a patient testimonial was, "It was really such wonderful information. I'm very grateful for the opportunity you had given me for today." And that's a lot of it too, is the stuff that we're going over are really managing side effects and symptoms that everyday patients have, and giving them more tools to put in their tool belt when they see dryness, redness, irritation. We have folks that are skilled in that trade as an esthetician or a nail technician, and come on board and can offer that support in conjunction with their care team to make sure that they have the best results and outcomes. This class also offers a lot of education, so it's really great to learn, to join with a notebook and have our patients take notes on things, whether they're going through them now or they appear down the line when they get further into treatment, or after their cancer journey is done and they're entering into survivorship. They may still have some side effects, so this is really great for them too. Just recently, we launched our very first pilot, which is one of 2 pilots for a program called Cook, Eat, Educate. This is really important to us because we're talking about the skin, the body, what you put on it. Now we're talking about what you put in your body. And a lot of that is making sure you make healthy choices. So we want to make sure that in all of this wonderful program we're doing for our patients, we find a way to extend it and really, again, care for our community. And that's the heart of what we do. So we want to make sure for this class, we're inviting our cancer patients, AHN and non-AHN, inviting their caregiver, and then their entire immediate family, including children. So if you know or are familiar or have been to a center, you typically don't see children, and that's because children are not permitted in the cancer areas where the patients are getting their treatments. They're allowed to visit in hospitals, but really in treatment, not so much. With this, it allows us to kind of break down some barriers for the family, to let them come in as a group, see other families that are also going through maybe a similar time, and just to empower them and bring them closer together. Maybe make a friend or meet and sit with another family while they dine, and realize that they're not alone. So we did host our first one on September 4th. A second one is coming up in November. We have a variety of educational tables. We had a local gardener with a focus of farm to table at the event. And then we had our wonderful chefs doing what they do best, cooking up a tasty, healthy meal for us. We had a lot of advocates attend too for the educational portion. And we were working with a non-profit part of a pharmaceutical company that provided cookbooks for everyone who was in attendance. So it was a sensational event, wonderful reviews, and can't wait to share more with that in the future. But the same thing, please call 412-330-4045 to register in advance and get on our list. Another program that AHN has to offer here with our integrative oncology is Reflections. Reflections was born out of patients being stuck in the hospital and wanting to get a slice of regular daily life and trying to relax. So we realized the importance after we did a pilot on site of patients coming into the hospital and receiving services. And one of the things that came out of that was just the importance of, again, getting them back into daily life as much as we could and having them feel better while in daily life. So thanks to the generosity of our donors, we've partnered with different small businesses throughout Western Pennsylvania. Our areas focus on the South Hills, Greater Pittsburgh, North Hills, and Erie. What our service does is it's a voucher that patients receive that covers the cost of a specialty service they can get with tip included, so it's at no cost to them. They simply call the number on the voucher, walk in the facility, enjoy their service, and walk out feeling like a new person, feeling re-energized, ready for the next week and whatever their treatment may bring for their future. These are available to AHN and non-AHN patients who are in active treatment. Patients may select up to 2 vouchers at no cost to them. And recently, we're actually having Dr. Miller give out those vouchers. So again, bringing it back to the doctors, the care team, the integrative approach, we're having our very own specialists customize a unique plan of care based on our patient's needs. A patient testimonial that I'd like to share here is unbelievable how wonderful the preferred providers are. So professional, excellent at their work, kind and generous. These services and interactions with the 2 lovely women, they went to 2 different services, have certainly made my days brighter and calmer and more relaxed. Thank you, and thank you for all the good work that you do. And that was from Mary. So as mentioned, Dr. Miller is able to give out these vouchers for Reflections in her integrative oncology clinic. Dr. Miller is tremendous. She has just surpassed anything we could hope for with this program and more. What she does is she meets with patients on Fridays during a half-day integrative oncology clinic to listen and discuss their disease, treatment-related side effects, and then together they explore different things that she would recommend for complementary therapies to help combat their side effects. You can walk into that appointment and know that you are getting her undivided attention, you're getting her care, her comfort and guidance and knowledge extended to you, and just working to meet those goals and achieve them. The 4 things Dr. Miller consults regarding would be health and fitness, diet and nutrition, image and appearance, and mind and body. During this time together, she'll review a menu of holistic approaches, and then again, create a unique plan custom to the patient to achieve those. Our goal is always to improve and enhance quality of life and healing outcomes while collaborating with established care teams. Dr. Miller is happy to see patients, again, AHN and non-AHN, by calling 412-330-4045. Currently, she's seeing patients out of the Wexford Health and Wellness Pavilion, Allegheny General Hospital, of course, virtual via Zoom. We've talked about that already. We're everywhere when we're in the community too. And then coming soon in December of this year, we'll be opening up our new integrative oncology office out of Jefferson Hospital. And with that, I'd like to turn it over to Dr. Sarah Miller. Thank you for your time.
Thank you so much, Lauren. Yes, so that is me, Sarah Miller. It's nice to be able to have time to talk about this this evening. Next slide, please. Thank Thank you. So today, the goals of my talk are basically to explain what the concept of integrative oncology is, explain the difference between complementary and alternative treatments, and with that, focus on several complementary treatment modalities and describe our overall current program at AHN. Okay, next slide, please. Thank you. So integrative oncology is an evolving evidence-based specialty that uses complementary therapies with medical treatment to improve symptom control and alleviate patient distress and reduce suffering. So that was one of the first definitions of it, the emerging field. Thank you. So important definitions that like to get out of the way. Complementary medicine is using a therapy in conjunction with conventional medicine. Alternative medicine is using therapy in place of conventional medicine. Integrative medicine is using this evidence-based complementary medicine practices in coordination along with a patient's conventional cancer care or conventional care. And integrative oncology is using complementary medicine in our oncology patients. So integrative oncology, it should address symptom control with non-pharmacological therapies, all the while suggesting evidence-based adjuncts to mainstream cancer care. Goals are only to improve physical and emotional health. Therapies that are recommended are generally non-invasive and found to be safe. And most have evidence behind them that backs their benefit. So it does not, integrative oncology would not discuss alternative-based therapies, which are often promoted as anti-tumor therapies that do not have scientific evidence of safety and efficacy and have the potential to cause harm. All right, so this is a busy slide, but overall, the cancer process is very, very complicated. So when a patient is first diagnosed, the first question they have is like, well, what did I do wrong? What did I, why did this happen? And there are just so many things that we know of that we feel that play a role into somebody developing malignancy. So a lot of these are an environment, which is sometimes harder to control. But there are diet and lifestyle factors that are more within a person's control. And then there's a lot of things coming out about inflammation in the microbiome and just a whole bunch of other things that are specific to the person that we can address. Thanks, Lauren. All right, so pretty much we want to make sure that we treat the whole person. So when someone is diagnosed with cancer, we don't want to just treat the cancer, we want to treat the person. And each patient will have their own different set of challenges that they come to us with, and we want to basically find out what hurdles they need to jump over and equip them with the information and tools they need to get over those hurdles. So complementary therapies, here's just a general menu of when we say complementary therapies, what we're referring to. So I will go over some of these in detail, but acupuncture, massage, Reiki therapy, anything that involves improving mental health, such as meditation, mindfulness, nutritional counseling, you name it. Okay. Thanks. So in our integrative oncology clinic, you can meet with myself, and we would discuss your specific oncologic diagnosis and treatment and how the complementary therapies can enhance your care specifically. So reasons that people would seek out complementary treatments is the potential to improve one's overall health and well-being. And a lot of times people will seek these treatments out during cancer treatment to reduce the severity of adverse drug reactions. The goal is always to improve quality of life during and after their cancer treatment. And plus, patients could have a better sense of control over what complementary treatments they pick. When I talk to my patients about chemotherapy, I always say like they're picking off of a menu of a restaurant they don't want to eat at, like don't want anything. And this way we're able to offer kind of a menu, so to speak, of things that they would be interested in and can only improve their quality of life. So this is a very cheesy analogy, and I do apologize, but this is how I explain our program at AHN to my colleagues on the medical side of things, so they can kind of understand, what it is we aim to do. All right, so so I describe our program at AHN as an airline. All right, so the airline is the cancer network, and in the air, the pilot and co-pilot. So that is like the main treatment team. That's the radiation oncologist, surgical oncologist, medical oncologist. They decide what exact path we're taking, right? The passengers are patients, are flying to an undesirable location. They are not happy. They don't want to be going. Maybe they're visiting their in-laws. They're nervous. They're uncomfortable. And the integrative oncology team, what we are is we're like the flight attendants. So we're trying to make the flight as comfortable as possible, concentrating on safety first, offering complementary programs and treatments. Will not redirect the plane. So if a patient sees me, I will not say, oh, let's change your chemotherapy to this or that. It has nothing to do with that. It's simply how to enhance and improve this current situation that is going on. And then I always make the joke that on the ground is the air traffic control, and that's the insurance companies which control everything. All right, so this is Lauren touched briefly on this. I call this our in-flight menu, and this is just under those 4 categories: health and fitness. We have Dr. Champ's wonderful exercise oncology program, oncology rehab for strength and training and resilience, lymphedema therapy. We have the healthy food center. We have wonderful nutritionists available for our patients. And then under image and appearance, all the programs that Lauren mentioned that our patients really love. Under mind and body, we have we've aligned with wonderful therapists that perform acupuncture, massage, and Reiki for our patients. And then AHN has a wonderful behavioral health group that really reaches out to our patients, specifically our oncology patients for their concerns. So acupuncture, I'll be very brief on this part. So it originated from traditional Chinese medicine. Needles are inserted at specific points. Animal studies have shown us that acupuncture increases feel-good neurotransmitters. So those are the chemicals in the brain that lead to feeling pleasure and relaxation. The NCCN is one of it stands for National Cancer Consortium Network, and it is one of the main organizations in oncology where a lot of, I know me personally as a physician, I look to them for guidelines, and this organization recommends the use of acupuncture for pain, fatigue, nausea, vomiting, and treatment associated or hot flashes. So a lot of our complementary therapies don't have these huge clinical trials that pharmaceuticals have to back their efficacy. This is just real brief, was the largest one that I've seen. It had to do with acupuncture in 226 postmenopausal women with breast cancer that were receiving treatment with an aromatase inhibitor, which is an estrogen lowering medication. And it would be really hard, you would think, to create a placebo group for the acupuncture, because they obviously know if they're getting acupuncture or not. So what this study did is they had a patient that got acupuncture and they had the therapist place the needle in the appropriate regions. And this other group that they called it sham acupuncture, where the therapist would put the needles in the regions. I don't understand any of this either, but that was not specific for what their symptoms were. And there was actually a statistical difference between the treatment group and the sham group. So that basically negated the placebo effect, because both groups were actually undergoing the acupuncture. This was helpful because it can often eliminate the need for a patient to take another medication to alleviate the side effects from another medication. And it also can lead to adherence to prescribed anti-cancer therapies. Additional benefits, briefly improves cancer-related fatigue, can improve pain that comes from chemotherapy-induced neuropathy, improves chemotherapy-induced nausea and vomiting, decreases frequency and severity of hot flashes, and overall decreases stress in general. Okay. Massage therapy has been found to reduce cancer-related fatigue as well, reduce pain, improve mood. We use a lot for patients with lymphedema, as well as it can decrease nausea. In oncology massage, the massage therapist knows exactly what safe pressures to apply and what sites to avoid. So Reiki is also available at AHN. It's Japanese in origin, and Reiki means universal life energy. So it's based on the idea that the practitioner can promote healing by encouraging the flow of energy. So small studies have shown that Reiki can help improve pain, anxiety, and fatigue, virtually no side effects or contraindications. And I always stress to patients, this is to alleviate side effects, that we don't have proof that it actually, helps in their anti-cancer journey, but it definitely can relieve side effects from their cancer treatments. All right. So mindfulness-based interventions, there are a lot of randomized trials that mindfulness-based strategies for stress reduction really decrease depression, anxiety, fatigue, improve sleep. And again, I had mentioned our AHN behavioral therapy group that helps teach our patients these type of techniques. And mindful meditation is very popular out there. It was new to me when I was first learning about it, but they have complimentary sessions on YouTube, and pretty much a practitioner will teach you to just be calm and observe your thoughts with non-judgmental attention. I'm one of those people that are always thinking of 40 things at once. So it's challenging, but if you can train yourself to do this, it has been shown to decrease anxiety and improve sleep. Okay. Next one. Thanks. So next we talk about the power of movement. So two movement practices are yoga and Tai Chi. Yoga has to do with the meditative movement that originated from Eastern medicine. The goal is joining the mind and body. And this practice focuses on breathing while doing certain postures. Tai Chi is an ancient movement practice based on Chinese martial arts. It concentrates on slow and flowing movement sequences. Tai Chi has been found to be very safe and gentle. A lot of it can be done even while sitting. So it is extra appealing for people with disabilities and the elderly. Studies have shown that it improves balance and reduces the risk of falls. In our oncology patients, there has been a trial specifically in lung cancer patients on chemo that showed a considerable improvement in their fatigue. Thanks. Another thing that we touched upon briefly, the integrative oncology consult, is natural products. So the natural products fall into the topics of herbs, which are botanicals, vitamins, minerals, and probiotics. So it's been eye-opening for me to realize how many different things that are out there that patients bring up to me. It's estimated in the general population, about 40% of people use these type of therapies. And there is a potential for harm with natural product use, and it has to do with 4 basic potential interactions. And just very briefly, there's a risk for high dose antioxidants that they could actually interfere with the efficacy of chemo. We have to worry that some herbs don't augment a blood thinning effect in our patients already on blood thinners. We worry about phytoestrogenic herbs, which means they are herbs that our body encounters and treats as estrogens, as for our patients that are taking estrogen lowering medications, that would fight that. And also direct organ toxicity. A lot of times herbs can cause elevation in renal and hepatic function testing. So additional concerns, there is some quality control because there's really no FDA regulation. And sometimes there's a lack of dialogue between the patient and treatment team. So there are useful databases for clinicians as well for patients to kind of check on the safety of their supplements. So one such resource is the Society of Integrative Oncology. Now this society doesn't necessarily suggest that one uses supplements routinely through cancer treatment, but it will show you if something is safe or not in the natural product database. All right, so this organization is missions to advance evidence-based, comprehensive, integrative healthcare to improve the lives of people affected by cancer. Their website is great. There's a lot of patient materials, including data that supports multiple treatment modalities and supplements. I will not go into detail with this. This was just encouraging that through the Society of Integrative Oncology, the American Society of Clinical Oncology, which sets guidelines that oncologists follow, that they're starting to recommend, like in our mainstream treatment journals, certain complementary practices. These ones are for patients with anxiety, and they also have that are dealing with cancer. And there's also one with patient experiencing pain during their cancer therapy. So that is, the hope is more of these professional organizations recognize the complementary modalities as a viable treatment option, that more and more of these would be covered by insurance companies in the future. Thanks. And this is just another example of a journal article from Journal of Clinical Oncology showing that patients experiencing cancer pain can use a certain integrative therapy, and it's been found to be helpful. All right, so our biggest hurdles so far, as I mentioned, insurance policies do not routinely cover complementary care like massage, acupuncture. We want to, at AHN, eventually make all the therapies accessible to all. So align with therapists in all areas of our region, so someone is not driving too far to get their acupuncture. And it is hard as a medical oncologist, it's really hard to incorporate these types of discussions of complementary care into a patient's office visit, because we're so busy talking about the treatment plan and a million other things and test results. So it is hard to educate, and discuss like the needs with our patients. So the goals of our integrative oncology program are to discuss these complementary modalities in detail, counsel on the safety of supplements, provide a comprehensive overview of all services provided at AHN as well as those available in the community, and make treatments accessible to all. So a quick summary: complementary therapies have been tested in terms of safety and benefit. Alternative therapies have no scientific evidence to support safety or efficacy. Complementary treatment modalities offered at AHN include acupuncture, oncology, massage therapy, and Reiki. And the goal of our program is to offer our patients a smooth and comfortable flight throughout their journey with us. Okay, I think that's next slide, Lauren. Thanks. Thank you.
Thank you so much. That was very informative. At this point, we will open up to any additional questions. Folks can put any questions into the chat, and we can entertain any questions. We'll give a minute to see if any questions arrive in the chat before we close. Okay, I'll check that again in a minute, but we want to thank you for attending our Ahead of Cancer lecture this evening. Please continue to join us monthly at our Ahead of Cancer lecture series as we focus on cancer screening, early detection, treatment, and survivorship. As a reminder, tonight's lecture was recorded. If you're interested in rewatching tonight's lecture, check back on the AHN YouTube channel, www.youtube.com/Allegheny Health Network, for the full recording in about a week or two. This video, as well as other past lectures, will be posted under the Ahead of Cancer playlist. In addition, if you would like to schedule an appointment or have any questions regarding a potential cancer concern, please call the Hope line at 412-578-4673 to schedule an appointment. We'd like to thank you. Let me just see if there's any other questions that came into the chat first. Oh, wait, hang on, there might be a question. How do we set up a meeting with Dr. Miller to see if we have coverage? You can call the Hope line, 412-578-4673, that's displayed on the screen there.
They can also call our office at 412-330-4045. I actually have the cell phone with me. It'll ring too. So if you call, I can answer and get you scheduled tomorrow or Monday. So all of our programs are free, like we mentioned. There is a fee associated with seeing Dr. Miller. When we created the program, one of the important things we really tried to get was, if you are established at AHN, you're billed the same way you would as if you see your current medical oncologist. If you see an oncologist outside of AHN, then you're building a new patient appointment to see Dr. Miller in her clinic. So just know if you are established, we can get you in, and it is a lower cost to you. You're considered a return patient, not a new patient when you see her, which is real important for billing.
Great. Thank you for that clarification, Lauren. And with that, I don't see any, I don't believe I see any additional questions. Let me just check one more time in chat.
And if I could just mention too, if anyone is
Sure.
interested in supporting our integrative oncology program, making a donation, donating a wig that we can professionally wash and sanitize and upcycle to put back into our program, please don't hesitate to call that number either, or reach out to myself or Margie or the Hope Line, and we're happy to work with you. We have lots of sponsorship opportunities, and that's how we're able to fund all these programs at no cost to patients.
Okay, great. Hang on, there's something else in the chat here on the. Okay, if I have completed my chemo and radiation therapy stage but still struggle with neuropathic pain, am I eligible for acupuncture is a question. Or to be evaluated, I guess. The answer could be evaluated.
Yeah, you could definitely get evaluated. When you see Dr. Miller, she'll talk to you one-on-one about your goals, those side effects that you're having, and to see if acupuncture is right for you. And if so, then we're able to extend vouchers to help you get started with that process to see if it's something you want to pursue.
Great. And there was another one that says, can patients obtain a copy of the information, some of these slides, symptoms, and recommendations? The recommended integrative therapy, is there a booklet? So we can, you will have access to this presentation as well in the future, based, as I mentioned, with the YouTube channel. Do you provide suggestions on preventative interventions such as information on cold or compression therapy to prevent neuropathy from certain chemotherapies?
So in general, it's one of those things that we don't have great data on it. There's more data in Europe in small studies. So there is some data out there, but it's very cost effective, like in terms of what cancer treatments cost. The cryotherapy, which are the frozen gloves and socks to wear during certain chemotherapy infusions in order to decrease the prevalence of developing chemotherapy-induced neuropathy, is very inexpensive. You can get them on Amazon, and they're like around under $50. And we have anecdotal information, like from our patients, the feedback we get. You know, we do notice less if the patient does get neuropathy, it's less severe. So we do recommend that, as there's really no risk for harm in that either. So.
Okay, great. All right. And this presentation will be available on the YouTube channel. There's folks asking about how to access the presentation. We don't typically email out the presentation. We'll email out the link to the YouTube channel. However, approximately a week or two following this event, you'll receive that email. And I want to thank Lauren and Dr. Miller for a great presentation this evening, and to thank all of those who attended the lecture, and wish you all a wonderful evening. Thank you so much for your time.
Thank you.